Thank you everyone for joining us today for our weekly COVID-19 community update. I'm joined today by Monroe County Public Health Commissioner, Dr. Michael Mendoza. We'll start by checking in on our numbers. We're reporting 241 new COVID cases today, which brings our 7-day average of new cases to 218. Last week on this day, we had reported 215 new cases, and we had a 7-day average of 202. So we're still seeing fluctuations in those numbers, and there's a slight increase from last week. We continue to be classified as an area of high COVID transmission according to the CDC. As for vaccinations, I have some good news to announce. We've hit a major milestone in our fight against COVID. According to the state's vaccine tracker, more than 80% of Monroe County residents ages 18 and older have had at least one dose of the vaccine. So I want to thank everyone who helped us to get there. Our doctors, our nurses, our partners in the state and local governments who have all worked tirelessly to keep our community safe. And a special thank you to all of you who stepped up and did the right thing. You got vaccinated. Your decision will keep yourself, your loved ones, and your neighbors safe. And that said, our fight is still not over, and we're continuing to expand access to vaccination clinics. Today, I'm announcing that starting next week, we'll be opening new vaccination sites at the former Steinmart in Pittsford Plaza and at the old Bed Bath & Beyond location at Grease Ridge Mall. Both locations will begin accepting appointments and walk-ins next week. These sites will be offering all available vaccine doses, including Pfizer booster shots, and if there is federal approval for the Moderna boosters in the coming days and weeks, those will be available as well. The days and times of operation for both sites will be available first thing Monday morning on our website. These two new locations will not distract us, though, from our primary focus, which continues to be increasing the vaccination rate in their performing communities across the county, and particularly within the city of Rochester. Community-based clinics offering first and second doses, as well as Pfizer booster shots, are available at various sites all across the city of Rochester, in addition to our Fleet Center and MCC downtown campus clinic. All the information on times, appointments, locations, and more can be found by visiting www.monroecounty.gov or by calling 211. Getting vaccinated continues to be the best and most effective tool our community has to combat COVID-19. It's safe, it's free, and it works. We have teams working 7 days a week to bring this life-saving vaccine to residents across Monroe County. And to do so, we're continuing to hire nurses, health clerks, and EMTs to staff our vaccination sites. These are good-paying jobs that are critical in our fight against COVID. More information can be found right on the county's homepage, again at monroecounty.gov. We also have some very good news for students needing PCR tests to return to school. Pediatric Pcr Testing is now available at the Monroe County Fleet Center on Paul Road, utilizing county-purchased Acula point-of-care PCR rapid test units. These rapid test units will give test results in hours, not days. This is a drive-through paperless transaction clinic, and testing is done using a less invasive lower nasal swab. And I do want to make it clear this is an appointment-only clinic. Appointments, again, can be made on our website at www.monroecounty.gov. These tests are available to school-age children, ages 4 through 19, and they need to meet certain requirements and cannot be under quarantine by the Department of Health. Your child needs to be symptom and fever-free without fever-reducing medication for 24 hours, and they must be enrolled in a K-12 school. We launched this site as a way to recognize that many parents and students are having difficulty getting tests in a timely manner. The drive-through site provides fast results so students can get back into school as quickly as possible. This testing site will also reduce the current burden on our local pediatricians who are overwhelmed right now with testing requests since the school year started. As of right now, we're able to process about 60 of these tests each day, and we'll be able to expand that in the coming days and weeks ahead. And I can tell you, as a parent of 2 children myself, I can know firsthand the struggles that our parents are having and our students are having every day, getting back to school as quickly as possible, and the need to increase this PCR testing. And so this PCR testing, particularly the rapid results that we can get from this additional PCR testing will help get students back in school as quickly as possible, particularly those who are negative results, because I know they're waiting so long at home to get back to school, particularly as they're symptom-free. So now with that, I can introduce Dr. Michael Mendoza, who could talk a little bit more about the testing and vaccine. Thank you.
Good afternoon. Thank you, County Executive Bello. I don't actually have that much more to add to your comments this morning, but I would like to draw attention to the fact that our COVID case numbers and the number of COVID patients being hospitalized are not yet going down, as they are in many other parts of this country. Throughout this pandemic, our region has lagged behind others when it comes to community spread and hospitalization. So I do hope that these numbers will improve in the coming weeks. But I want to remind everybody that the weather is also turning and the holiday season is coming back around, which means that more people will be going inside, gathering with family and friends, and traveling. So we are not out of the woods yet. We still need to proceed with caution. So please get vaccinated if you have not already done so. If you are eligible for the vaccine, please go ahead and get it, and continue to wear your masks when you will be spending time indoors with people outside of your household. Also, please take quarantine and isolation orders seriously. We know that we are seeing a lot of spread within households. I know you are tired of fighting this pandemic, and we all are, but we cannot let that lead to our complacency. It is not the time to let go of all the things that we know work. I do want to add also that with regard to the testing sites, the goal, as the county executive mentioned, is to get kids back in school as quickly as possible. But that does not mean that we want to forget about the importance of our family physicians and pediatricians. So if your child is ill, very sick, or you have any concerns, please do not hesitate to reach out to your pediatricians or family physicians' offices. The goal of these clinics is to get healthy kids back to school, but we still want our sick kids to get the proper medical attention. So with that, I will turn it back over to Julie and the county executive and be happy to take your questions.
Thank you, Dr. Mendoza. Our first question comes from Wendy Wright from Spectrum.
Right now.
Hi there. Thanks for taking our questions today. I wanted to ask you if the county is taking is communicating with the governor at all about any type of a backup right now in regards to having some folks come in. She had promised initially saying that if there were shortages, that there would be some help provided. You know, we obviously have some problems going on with area medical centers, including, you know, in the EDs. I know that you're aware of some of this. There's a clear shortage and people are waiting significant times in the EDs. We have urgent care centers that are closed. So what types of conversations are you having, if you are, and if you are having them, tell us what's planned to try to alleviate this problem.
Yeah. So we have had those conversations, and we started a couple weeks ago when after the mandate, the vaccine mandate, a deadline came and passed. We could see the impact that it had on the hospitals, and as you said, what we did was we met with the hospital systems here across the community. We pulled everybody together to look at what is causing delays in the hospital systems. And as we've talked about week over week, the delays really are in being able to move patients who are in the hospital system that don't really need a hospital bed. They don't need an acute care setting. They need to be moved into a nursing home. And how can we turn on, again, that flow from patients in a hospital into a nursing home facility? So we looked at nursing home facilities across the county and where available beds were to identify what staff would be needed in order to open up those beds. And then we have had those conversations with the state to let them know how much staff would be needed based on how many of those patients are currently in a hospital, how much staff would be needed to turn on that many beds at the local nursing homes.
It seems though that there's just a lot of talk and stuff is happening, you know, there are like a lot of good plans in place and a lot of discussions, but like right now there are people backed up in hallways in the EDs, and this is this is what folks are telling us, not just one or two people, but a lot of people.
Yeah.
So like, is there anything like immediately? I mean, you know, there was talk of National Guard and all these other things, like right in the next couple of weeks and this weekend, something more immediate. I know there's a lot of good planning for longer term.
Sure, sure. And yeah, and we've communicated those of what we would need to turn those beds on and to be able to do that. And so we're working through that, right? And what the county can directly do is we have one of those nursing homes with beds. So we've worked very hard over the last couple of weeks to bring on additional staff. We just had a new employee orientation just a couple of weeks ago. So we've been able to bring on additional staff and opened up a couple beds this week, or a few new beds this week. So we are starting to be able to turn those back on at Monroe Community Hospital, which is actually one of the larger nursing homes that has one of the larger capacities that can open. So we're doing everything we can here at the county to make that happen. But you know, I understand that, and we hear from the hospitals, we hear from patients every day, but it's going to take some time, I think, to work through.
Thank you.
Yeah.
Your next question comes from Jane Chaco from 13 Lamb.
Hi, I was wondering if the state, following up to Wendy's question, if the state was open at all to providing incentives to bringing workers, financial incentives to bringing them to work, since a lot of these hospitals and healthcare settings are saying additional workers, we don't know where they are, where they would come from. We can't pull them from another hospital to work in a nursing home.
Well, I don't know if the state is providing incentives like that. We would have to talk to the state about how they're incentivizing. I know that, the hospital systems, I know they're doing everything they can, working with the staff available to them, just as we are at Monroe Community Hospital to keep our employees working and also to fairly compensate them. They're working incredibly long hours right now, and to compensate them for that work. But you'd have to talk to I don't know if the state is offering any kind of incentives right now.
Okay, and a question for Dr. Mendoza in regards to testing at school. Has the surveillance testing started yet, and how's it going?
I do know that it has started at a number of schools. I meet, as you know, with the superintendents every week, and I have not heard really of any major challenges to that. The schools are testing, a rolling sample of students, not testing everybody all at once, as we had discussed, because we want to have a way of checking in on those individuals who've consented to have the testing every week, so we have a good picture of how things are evolving. But you'll have to contact the individual schools, but to my knowledge, I'm not aware of any major concerns.
Thank you, Jane. Raquel Stephen from WXXI, you're next.
Hello, good afternoon, guys. First of all, I appreciate that this briefing is earlier in the day. It does well for the deadlines. First question, as far as PCR testing, we know parents are upset. They're waiting at home with their kids. Is there a possibility of having rapid PCR testing in schools? Because up the street or down the street, whatever you want to consider, Ontario County is having rapid PCR testings in their school. Is there a possibility to have this done in Monroe County?
Yes, we're actually exploring that as we speak, doing some piloting to work out the bugs. As you can imagine, up and down the street are less populated than right here in Monroe County, and so we have a lot more coordination to do with our local health care systems and the pediatricians and family doctors' offices. So we'll have more to share about that next week.
Okay, and my last question would be the cases, the rising cases. What can we attribute this to with our high vaccination rate? Why are the cases spiking? What can we attribute this to?
I think we can attribute this to a couple of things. Number one is that we're testing more, which is good. Our positivity rate has remained the same, so that's also good. So I see this, first of all, as that we're testing more, we're finding more, which is not a surprise. Things are getting colder. People are going indoors. We have consistently lagged behind the rest of the country in terms of the beginning of our surge, and we've also lagged behind the country with regard to the end of our surge. But if you look at the last several weeks, things are looking as though they're plateauing. Obviously, there are some days that are blips that are higher and lower, but when you look at the 7-day average, Things look stable from my perspective, but here in the health department, that doesn't allow us the chance to take a breath. We're still going to keep our foot on the gas and make sure that we're doing all the surveillance that we can. And I ask that the public will do the same. I know that people are tired. I know that the pandemic patience is wearing thin, but we all want to get through this healthy and safe. So let's just keep going with the things that make sense, the things that we know work.
Thank you. Do we have a reporter on from News 8? Go ahead, Allie.
Mm-hmm. Well, we've been preparing for this certainty, really, for several weeks now. A couple of features that I think we want to call attention to is that, first of all, 5- and 6-year-old individuals are not likely to feel as comfortable in a mass or a large vaccination site. We know that our pediatrician community wants to have the chance to see all of these individuals, not only for their COVID shot, but also for their routine care, making sure that their other immunizations are up to date. So our focus really is going to be shifting away from these larger central sites to the family doctor and pediatrician's offices for those individuals who have a primary care home. We will certainly be here as the county for those individuals who are having difficulty accessing those primary care sites. But in general, we're going to want to start shifting our efforts towards smaller sites, areas that are more comfortable for our pediatric population and their parents. So more to come on this. You heard about our 2 sites on the east and the west side. We're looking into another larger site in the city, in addition to all of the smaller so-called pop-up centers that we have in the city that are ongoing as we speak. But we're certainly going to have to change our effort because we're looking at a very different population once 5 to 11-year-olds are eligible for the vaccine. For those who are eligible to get the vaccine, my number one recommendation is to get the vaccine. That is the single most important intervention that we can take to prevent anything unnecessary through Halloween. And beyond that, for those who are not eligible, obviously, to continue the same precautions, our recommendations are largely going to be the same otherwise as they were last year. This year, thankfully, we have a larger group of people who are vaccinated. Last year, we didn't have anybody vaccinated. But again, wearing your masks indoors in particular, because we know that the vast majority of concern is in those indoor gatherings. So when you get home from trick-or-treating and you're at home counting your candy and sorting things out, as we all did, please make sure you wear your mask when you're indoors.
Next question comes from Patty Singer with Minority Reporter.
Hi, thank you. With the cases in the recent couple weeks, around 200 a day, and what Dr. Mendoza had said, twice already today, it reminds me of the scene from The Perfect Storm, where the crew member looks up at the clouds and says, "Skip, I don't think the storm's going to let us go." And so, without the platitudes and without the politics, for each of you, what is your emotional state right now as you continue to see these numbers and you continue to have to deliver the same message week after week? Is it, Skip, is it ever going to let us out, or what? How are you guys feeling about this?
Well, I'll start by saying that we're not new to this. Here in the health department, we're used to looking at numbers that look concerning. It's a constant reminder that even though we may be sick and tired of the pandemic is not done with us. Will it let go? Yes, I do think so. I think, there is a lot of reason for optimism. There are a lot of reports across the country of this being the last major surge because we are now looking on the horizon of having the next large group, 5 to 11-year-olds, being eligible to be vaccinated. We have a large amount of people who are already vaccinated in the 12 and older group. But of course, with the winter coming, there is still some uncertainty. So I won't say that we're out of the woods at all. But there's reason for optimism. And from my standpoint, we've got a job to do here in the health department, and we're going to keep doing it until this is over.
Patty, I'm sorry, I couldn't hear your question before, but I just got it. I would say this, there is, I'm going to answer it two different ways. There is a Groundhog Day quality to this. Every week we talk about our numbers. Our numbers have been relatively flat every week. They're not really surging high. They're really not going low. So we're talking about the same thing every week, week in and week out. But I would say that my outlook on things, though, is positive because, you know, one of the things we saw in our numbers is that they are static. They're relatively flat. And we do lag the rest of the country. So in terms of when the spikes happen, if you look back fall, we lagged quite a bit behind. We were a lot healthier before the rest of the country got a lot sicker. It was getting sicker, and now coming out of it, you know, you're starting to see places coming down, and we're sort of flattening here. So my expectation is that we would probably start coming down here at some point. So I'm optimistic, and I'm also optimistic because we're having a lot of conversations too about what comes next, right? How are we fixing the economy? How are we building Monroe County back? We have a lot of resources coming our way from the federal government to be invested in public health and infrastructure and the economy and how we're putting people back to work, keeping schools open, things like that. So a lot of things that we were questioning maybe a year ago, how would the year play out? We're not really having those same questions anymore. We're able to talk about all these other great things that we can do. So I'm optimistic about the future, but we also don't want to get distracted. So even though I said earlier there's this groundhog quality to some of the briefings that we do, we're not going to stop doing them because at the end of the day, there is one way out of this because we always talk about what's the end game. The end game here, I think, is getting as many people vaccinated as possible. So you have, you know, get back to that conversation of having herd immunity and what does that look like, right? Because COVID's not just going to go away one day. We're not going to wake up and it's gone, but it's going to have to become manageable. And we get there by vaccination, you know, and that's why when you hear Dr. Mendoza even say, okay, what's your advice for Halloween, right? Well, we also have Thanksgiving coming up, right? So Thanksgiving, I know people are going to want to travel. We're going to be moving around. We're gathering with our families. Last year, we were having these conversations about how many people can gather inside a single house, if you remember that, and how divisive that was across, you know, the country, these conversations. We're not really having that same conversation anymore because the real advice is to get vaccinated. If we're vaccinated, we don't have to have that same level of concern. So I'm optimistic. The conversation today is a lot different than it was a year ago. And I think, you know, even 3, 4, 5 months from now, it'll be even better. But we really do have to get vaccinated. Even though we're over 80%, we're still not going to stop until we reach everybody in our community. And everyone has an opportunity to make that decision for themselves with full correct information about whether or not the vaccine is appropriate for themselves.
Breakthrough cases with who knows what other variants going to come through, and with people traveling from other parts of the country where masks are not worn as assiduously as they are here, and with other standards. I mean, are we potentially looking at November, December, and January the same way we were last year? I mean, we're taking care of ourselves in Monroe County, but when you bring in travel from other parts of the country, that seems to me to be a huge X factor. Your comments on that?
Well, there's always an X factor. I think with the pandemic, we've had many X factors along the way. I am reassured by the fact that we have a largely vaccinated population. And, you know, people are traveling throughout the summer, have been traveling throughout the fall. You know, we have to just be vigilant. You know, we can only do what we can do. We have to keep an eye on how things are going. But I don't think the numbers warrant the strict adherence to these kinds of travel guidelines and capacity restrictions that we had last year. I just don't think that there's a role for that right now, given the data and given how things are evolving. But you know, we'll continue to watch things, and if we have to make changes, we will. But my hope is that we won't have to.
Thank you, Patty. Our last question comes from Patrick Musignac from WHEC.
Good afternoon, everyone. Basically, Dr. Mendoza, I know the numbers keep coming out daily, but where do we currently stand with the Delta variant right now in our area? Exactly where are we?
Well, if what you mean is what proportion of the cases are Delta variant, it's still extremely high, if not all of the cases that we're seeing. We're not doing very active surveillance on these variants right now because there's really no reason to. The data across the region and the state, in fact, are showing that the Delta variant is by far the most predominant variant in circulating. So, we're waiting for things to head down, just like they have been in the rest of the country. But until I see that, we're not going to make any conclusions before we can. And that's why we're reminding everybody today to make sure you observe your isolation and quarantine orders. When we see that there are initial cases in a household, and then 2 and 3 days later, we see 2 or 3 more people in that same household, the conclusion's pretty clear. There is in-home household spread. Very hard to prevent, but very hard to quarantine, very hard to isolate in your home from your other members of your household. But the reality is that this is where a lot of our cases are coming from. And, we don't want to take any unnecessary chances with people's health. So, the Delta variant is going to find its way out of our community in time. But until then, we're going to keep doing what we do and stay vigilant.
All right. And then my other question is a follow-up on the PCR testing. Do you think the PCR testing will help with dropping the length of quarantine times for students at school?
That is being considered at a state level. Until now, we have not used the test to get yourself out of quarantine because the largest risk for being quarantined is the fact that you have a contact. But there is a risk and a benefit there. If you shorten the length of quarantine with the test, you run the risk of having somebody inadvertently spreading the illness beyond others once they've left quarantine. So there's always going to be a risk and a benefit to every intervention. But we're looking into that at this moment.
Thank you.
That was the last question.
That's it for questions.
So,
Do you have anything else?
Yeah, thanks, Julie. I'll just add one thing to that too, because the expansion of the PCR testing to school-age children, where we're able to offer PCR testing that's free, and again, it's targeted towards school-age children, is also to help, because any parent, if you talk to any parent or teacher or administrator in the school system, one of the challenges that they're all facing is the availability of a PCR test, because once a child's symptomatic, they have, in order to come back to school, once they have any symptom like that, they either have to have a negative PCR test or an alternative diagnosis. And in order, the availability of PCR tests in the community is keeping healthy children from being able to get back to school as quickly as possible. And our goal all along, even going back to last year, is to make sure that our children can get back to school and stay in school. So this is, one step that we announced today to help expedite that process, get more PCR testing availability in the community. And of course, it's free of charge. You have to do it by making an appointment on our website. So thank you, everyone.